Prostate cancer develops when cells in the prostate gland begin to proliferate uncontrollably. The prostate gland is exclusively present in men. It produces some of the fluid found in sperm. The prostate is located underneath the bladder, the hollow organ that stores pee, and in front of the rectum, the last part of the intestines. Seminal vesicles are glands located just behind the prostate that produce the majority of the fluid for sperm. The urethra, the tube that transports urine and sperm from the body through the penis, passes through the middle of the prostate. The prostate size might alter as a man matures. It is around the size of a walnut in younger men, but it can be much bigger in elderly guys. Prostate cancer types. Adenocarcinomas are the most common kind of prostate cancer. These tumors arise from glandular cells, the cells that make the prostate fluid that is added to the semen. Other cancers that can begin in the prostate include cancers of the small cell, neuroendocrine cancers or other than small cell carcinomas, transitional cell carcinomas or TCCs, and sarcomas. Other kinds of prostate cancer are uncommon. If you are diagnosed with prostate cancer, it is almost certainly an adenocarcinoma. Some prostate tumors spread swiftly, while the majority spread slowly. Indeed, post-mortem investigations demonstrate that many older men, and even some younger men, who died from other reasons had prostate cancer that had never harmed them throughout their lifetimes. In many cases, neither they nor their doctors even knew they had it. Some study implies that prostate cancer begins as a pre-cancerous condition, albeit this is not proven. These disorders are sometimes discovered after a prostate biopsy in a man, removal of small pieces of the prostate to look for cancer. A risk factor is something that increases your chances of having an illness like cancer. Risk factors for various malignancies vary. Some risk factors, such as smoking, can be modified. Others, such as a person's age or family history, are unchangeable. However, possessing a risk factor, or even several, does not guarantee that you will get the illness. Many people who have one or more risk factors never develop cancer, and others who do develop cancer may have few or no recognized risk factors. Researchers have discovered many elements that may influence a man's chance of developing prostate cancer, such as, first, age. Prostate cancer is uncommon in males under the age of 40, but the risk increases dramatically beyond the age of 50. Men over the age of 65 account for approximately 6 out of every 10 incidences of prostate cancer. Second, race or ethnicity. Prostate cancer affects African American men and Caribbean men of African descent more frequently than men of other races. When it does emerge in these males, they are usually younger. Asian American and Hispanic, Latino men are less likely to get prostate cancer than non-Hispanic white men. The causes of these racial and ethnic variances are unknown. Third, geography. Prostate cancer is most prevalent in North America, Northwest Europe, Australia, and Caribbean islands. It is less frequent in Asia, Africa, Central America, and South America. The causes behind this are unknown. More comprehensive prostate cancer screening in certain industrialized nations is likely to account for at least some of this discrepancy, but other factors such as lifestyle variations, diet, etc., are also likely to play a role. Asian Americans, for example, have a lower risk of prostate cancer than white Americans, but their risk is higher than that of Asian males of comparable ethnic origins. Fourth, ancestral history. Prostate cancer appears to run in certain families, implying that there may be a hereditary or genetic element in some cases. Nonetheless, the majority of prostate cancers arise in men who have no family history of the disease. A man's chance of having prostate cancer is more than doubled if his father or sibling has the condition. The risk is higher for men with a brother with the disease than for those with a father with the disease. The risk is substantially higher for males who have numerous afflicted relatives, especially if the disease was discovered while the relatives were young. Fifth, gene alterations. Several inherited gene alterations or mutations appear to increase prostate cancer risk, although they are likely to account for a tiny proportion of cases overall. As an example, Mutations in the BRCA1 or BRCA2 genes, which have been linked to an elevated risk of breast and ovarian cancer in certain families, can also raise the risk of prostate cancer in males, especially mutations in BRCA2. Men with Lynch syndrome, also known as hereditary non-polyposis colorectal cancer, or HNPCC, a disorder caused by inherited gene alterations, are more likely to develop prostate cancer. What factors contribute to prostate cancer? First, diet. Dietary factors with less obvious influence on prostate cancer risk. The precise function of nutrition in prostate cancer is unknown, however various aspects have been investigated. Men who consume a lot of dairy products tend to have a slightly increased risk of developing prostate cancer. According to several research, men who take a lot of calcium, through food or supplements, may have an increased chance of getting prostate cancer. However, most studies have not shown such a relationship between calcium levels in the ordinary diet, and it is crucial to remember that calcium is known to have other key health advantages. Second, obesity. Obesity, being highly overweight, does not appear to raise the overall risk of prostate cancer. According to certain research, obese men had a decreased chance of developing low-grade or slower-growing prostate cancer but a higher risk of developing more aggressive or faster-growing prostate cancer. The causes behind this are unknown. Third, smoking. Most studies have not discovered a relationship between smoking and prostate cancer. Some study has connected smoking to a slight increase in the chance of dying from prostate cancer, but this conclusion needs to be verified by other research. Fourth, chemical poisoning. Some data suggests that firefighters may be exposed to substances that raise their risk of prostate cancer. A few research have revealed a relationship between Agent Orange, a chemical extensively employed during the Vietnam War, and the incidence of prostate cancer, while not all investigations have established such a link. There is limited or suggestive evidence of a relationship between Agent Orange exposure and prostate cancer, according to the National Academy of Medicine. Fifth, prostate inflammatory disease. Some research have shown that prostatitis or prostate gland inflammation may be associated with an increased risk of prostate cancer, although other studies have not established such a relationship. Inflammation is frequently observed in prostate tissue samples that also include malignancy. The connection between the two is not yet evident, and study into it is ongoing. Sixth, infections spread through sexual contact. Researchers investigated whether sexually transmitted diseases, such as gonorrhea or chlamydia, would raise the risk of prostate cancer since they might promote prostatic inflammation. So far, research have failed to achieve a consensus, and no definitive results have been obtained. Seventh, vasectomy. Some research have revealed that men who have had a vasectomy, minor surgery to make males infertile, had a slightly higher risk of prostate cancer, while other studies have not. This probable relationship is currently being investigated. Is it possible to prevent prostate cancer? There is no foolproof strategy to avoid prostate cancer. Many risk variables, including age, race, and family history, are uncontrollable. However, there are several things you may take to reduce your chance of prostate cancer. First, diet, physical activity, and body weight. The effects of body weight, physical activity, and food on prostate cancer risk are unclear, but there are things you can do to reduce your risk. According to several research, men who are overweight or obese are more likely to acquire advanced prostate cancer or prostate cancer that is deadly. Although not all studies agree, a greater risk of prostate cancer has been reported in men whose diets are heavy in dairy products and calcium. For the time being, the best advice about food and activity to potentially minimize the risk of prostate cancer is to obtain and maintain a healthy weight. Second, maintain physical activity. Maintain a balanced eating pattern that includes a range of colorful fruits and vegetables as well as whole grains while avoiding or limiting red and processed meats, sugar-sweetened drinks, and highly processed meals. Limiting calcium supplements and avoiding too much calcium in the diet may also be prudent. This does not mean that men who are being treated for prostate cancer should not take calcium supplements if their doctor recommends them. Third, supplements for vitamins, minerals, and other nutrients. Early research revealed that taking vitamin E or selenium supplements might reduce the incidence of prostate cancer. However, neither vitamin E nor selenium supplementation were observed to reduce the incidence of prostate cancer in the selenium and vitamin E cancer prevention trial. In fact, those who took vitamin E supplements in the trial were later shown to have a slightly greater risk of prostate cancer. Some preliminary study suggests that soy proteins, or called isoflavones, may reduce the incidence of prostate cancer. Several research are presently looking at the potential consequences of these proteins. Taking supplements can have both advantages and drawbacks. Consult your doctor before beginning any vitamins or supplements. Fourth, medicines. Some medications may help minimize the chance of prostate cancer. Fifth, inhibitors of 5-alpha reductase. 5-alpha reductase is a biological enzyme that converts testosterone into dihydrotestosterone, DHT, the primary hormone responsible for prostate growth. 5-alpha reductase inhibitors, such as finasteride or Proscar and dutasteride or Avodart, prevent the enzyme from producing DHT. These medications are used to treat benign prostatic hyperplasia or BPH, a non-cancerous prostate enlargement. Both of these medications have been studied extensively to determine whether they can help reduce the risk of prostate cancer. Men who received either treatment were less likely to develop prostate cancer after several years than men who received an inert placebo in these studies. When the data were examined more thoroughly, it was discovered that men who took these treatments had fewer low-grade prostate cancers, but they had the same, or slightly greater, risk of higher-grade prostate cancers, which are more likely to develop and spread. Long-term, it is unclear if these medications alter mortality rates because males in these trials had similar survival whether they took one of these treatments or not. In some men, these medicines might produce sexual adverse effects such as decreased sexual desire and erectile dysfunction, impotence, as well as breast tissue development. However, they can assist with BPH urinary symptoms such as difficulty peeing and urine leakage or incontinence. The FDA has not authorized these medications expressly to help prevent prostate cancer, but doctors can prescribe them, off-label, for this purpose. At the moment, it is unclear if using one of these medications alone to reduce the risk of prostate cancer is beneficial. Men who wish to learn more about these medicines should speak with their physicians. Sixth, aspirin. According to some study, men who use aspirin on a regular basis may have a decreased chance of developing and dying from prostate cancer. However, further study is needed to determine whether the potential advantages exceed the hazards. Long-term aspirin use can have negative effects, including an increased risk of gastric hemorrhage. While aspirin may have additional health advantages, most doctors do not advocate taking it only to reduce the risk of prostate cancer at this time. Seventh, other medications. Other medications and nutritional supplements that may help reduce the incidence of prostate cancer are also being researched. However, no treatment or supplement has been proved to be beneficial in big enough research for experts to endorse it.